Good afternoon and welcome to the Linn County Public Health COVID-19 media briefing for March 5th, 2021. My name is Caitlin Emmerich and I'm a Public Information Officer for Linn County Public Health. I would like to introduce Heather Metter, Clinical Services Branch Supervisor at Linn County Public Health. Heather will provide an update on COVID-19 response and vaccination efforts and will be available for questions after prepared remarks. Go ahead, Heather.
Thank you. Good afternoon. Last night, the Iowa Department of Public Health announced expanded eligibility criteria for COVID-19 vaccine to Iowans 16 to 64 years of age with underlying conditions beginning on Monday, March 8th. The list of conditions which determine eligibility are listed on the CDC's website. This announcement has resulted in an increase of questions regarding vaccine availability and timing for this group. I will provide an update to explain how this will impact the vaccination strategy in Linn County. Linn County has many people in phase 1B that have not yet been able to receive vaccine. Approximately 60% of the 65 and older population in Linn County has received at least one dose of vaccine. And we are completing the first tier of phase 1B this week. Tiers 2 through 5 have not yet been offered vaccine, with the exception of the Johnson & Johnson vaccine that the governor reserved for frontline essential workers in the food, agricultural, distribution, and manufacturing sectors who work in or live in congregate settings that do not allow for social distancing. We realize for those that are 65 and older, or that are in phase 1B tiers that have not yet received a vaccine, that this expansion is extremely frustrating. We agree, as we have been working with our partners to vaccinate existing priority groups. However, the decision to expand eligibility criteria was made at the state level. Linn County Public Health had not anticipated the eligibility change to occur until later in the vaccine rollout, and was first notified of this change in eligibility criteria last night. Therefore, the vaccine allocated by the county to local vaccine providers this week for next week's appointments will remain dedicated to the 65 and older groups and the phase 1B tier populations. Beginning the following week, vaccine allocated by the county to local vaccine providers will include the expanded eligibility criteria. While our eligible population will be expanding, we will not be getting additional vaccine allocated to us each week at this time. Additionally, we do not expect to receive any additional Johnson & Johnson vaccine until late March. We do not know when we will see an increase in vaccine doses allocated to Linn County through Linn County Public Health. Vaccine allocated to pharmacies participating in the retail pharmacy program may offer vaccine to all eligible individuals beginning Monday. These appointments are on a first come, first served basis to all eligible populations. Retail pharmacy programs receive vaccine from the federal government. Hy-Vee also receives state allocated vaccine. Vaccine administered by these providers are directed by state and federal authorities and not at the county level. We ask you to continue to follow the prevention measures to prevent the spread of COVID-19, including wearing a mask, practicing social distancing, washing hands, staying home if you feel sick, getting tested, and getting a vaccine when you are eligible. We know we have asked our community to do this for a long time. It remains important to follow these recommendations until vaccine is readily available for everyone that wants it. As demonstrated over the past day, the COVID-19 vaccine rollout continues to be a fluid situation with frequent changes that require us to pivot and adjust. We ask for your continued patience as the demand for vaccine continues to exceed supply. I assure you that we are working long and hard every day to make this as simple and smooth for our community and our community partners as we possibly can. Linn County Public Health will provide updated information on COVID-19 at linncounty.org/COVID-19 through COVID-19 status updates and on Facebook and Twitter. For up-to-date information on COVID-19, sign up to receive COVID-19 status updates by using our Notify Me tool on the Linn County website at www.linncounty.org and selecting COVID-19 status update under the Newsflash category. Thank you.
Thank you, Heather. I do not see that there are any questions in our chat as of yet. So we do have one. So there's a question for you, Heather, from Michaela Ram. Michaela, go ahead.
Hi, thanks for taking our questions today, Heather.
Yeah.
Apologies for not putting my name up sooner.
It's all good.
So next week, when you start opening up vaccines for those with underlying medical conditions, are you going to be prioritizing them or setting any aside for age 65 and older, or is that also on a first come, first served basis?
So Michaela, thank you for asking that question. And that's a great question. Like I said earlier, we just learned about this last night. So we will be working this whole weekend to come up with those plans and make those plans available by Monday. So we want everyone to know what that plan is. But this was a big pivot, something that we did not expect. So we really need to group together, go through all this information so that we can make this as fair and equitable as we can for our community members.
Absolutely. And will you also be taking a look at whether certain medical conditions will be prioritized over others? Is that also part of your planning?
We're going to look at everything. So, this is, again, something that we did not anticipate to roll out till we were much further along in our tier population groups. So we're going to look at all of that. We didn't want to come up with something on the fly today, and we really wanted to take the time to look at all these things. So we're going to really look at it all this weekend and have more information for Monday.
Yeah, absolutely. And one more question, if I may. You've been kind of talking about how this was a sudden announcement. I wonder what kind of stress this puts on vaccine providers who you're working with and who are already feeling the stress under the current demand.
It's put a lot of stress on them. We've heard from a lot of our vaccine providers today because they were not anticipating this either. So they're getting questions from the community members too. Because again, this is a vaccine that a lot of people are waiting for. They have been waiting for it. They want to know where they are in line. So, and things keep changing on them and they keep getting different information thrown at them. So it's hard for our vaccine providers too. So we're going to make sure that our vaccine providers also receive all that information by Monday so that they can also help educate community members that call them.
Thank you.
Mm-hmm.
Thank you, Michaela. Our next question comes from Adam Karos at KCRG. Adam, go ahead.
Thank you, Caitlin, and thank you, Heather.
Yeah.
Do you know how, or do you have an idea yet, because the conditions are obviously very wide ranging, how are you expecting that people will people need to prove that they're a smoker, for example, to be eligible or have certain conditions? Do you have an idea of what that process will look like yet?
So again, we're going to work on that this weekend to really try to delineate all that out and look at all that. Some things I think, like being a smoker, might be very hard for some people to prove. So, but we're going to talk about all of that this weekend and have more of those plans ready for you on Monday. So it's really hard to tell you something for sure right now until we really sit down and do those planning sessions.
Do you have an idea what this expansion does? Like what percentage of Linn County's population is now eligible under these new guidelines?
It's going to be significant. When you look at all the different risk factors that are on the CDC website, we're talking about a large percentage of our population. When you talk about anyone that has ever smoked at all in the past or currently, when we're looking at obesity, we know that this is going to be a significant population, and that's why we're asking for continued patience. We know we've been asking for that. That's hard. People are tired of being patient and being told to be patient. We totally understand that, and we agree with you. But this is going to really increase the amount of people that are eligible. But again, we're not increasing the amount of vaccine that's coming into the county. And because we're not increasing the amount of vaccine coming in the county, people are going to have to wait a long time to get that vaccine. But we're going to work our darndest to come up with some really good plans to help our community as much as we can and to work with those vaccine providers.
You mentioned a few times that this came as a surprise to you and to the department.
Right.
How much of a strain does this put on your day-to-day abilities that you now have to pivot?
It is a strain. It's hard for all of our vaccine providers, such as I had just mentioned with Michaela. When we don't know that these things are coming out and we can't do planning beforehand, it does put a strain on it. But this is what we do at Public Health. We get information and we do planning and we work to protect our community. So we will work this weekend. We will come up with a plan and we will share it. Not something that we had anticipated or expected this weekend, but we're going to get it done.
Awesome. Thank you, Heather. Appreciate
Thank
it.
you.
Thank you. Our next question comes from Diego Hernandez. Diego, go ahead.
Sure, yeah, I just wanted to get some clarification. You said that you, as a county, will not be providing it until the week of March 15th.
Yeah, so right now, everyone that has a scheduled appointment for next week, all that vaccine for the remainder of this week and into next week is still for those that are 65 and over. And for that tier 1 population group, we're going to finish them up. So finish all those appointments. People are not going to lose their appointments. That vaccine has already been allocated for that group, and that will remain the same. So it'll be our next allocations that are coming in. So it'll be that following week when we'll look at expanding that with the new eligibility criteria that has come out.
And you don't have any appointments scheduled for that week yet?
We do not. So, you know, we have worked very hard here in Linn County that once vaccine comes into the county, that we get it into arms. Vaccine does not do any good sitting in a refrigerator. So we work very hard to get it into arms. So it is the expectation of our vaccine providers that once they get it into individuals' arms. So we don't have extra vaccine sitting in refrigerators waiting for people to come.
And then you said that, you know, knowing how to sign up, how will people be able to sign up? Will they be calling you guys or will you be calling them?
Mm-hmm. So those are great questions. And again, that is what we'll be working on this weekend.
Sure. And then how many vaccines do you currently get weekly?
So each week we get 36, I believe it's 3,600 vaccine doses that we get each week. And it sounds like a lot, especially when we look at some of our county partners around us that may get far less than that. So 3,600 sounds like a lot. However, we have 250,000 in our population. So it's going to take a while to get through everybody when that's the amount we're getting.
Sure. And then one more, if I may. You said, you know, essentially tiers 2 through or tiers 3 through 5 of phase 1B were almost skipped. When you start scheduling and allowing those that are in this new extended group to start making appointments, you said that you're not sure yet of where the priority will lie.
We will still have vaccine going to those tier populations in that priority group, but we will be looking to see how that will roll out and what that will look like. And I think it'll be important for people to remember that you may be waiting for your priority group to come up, but you may also qualify for a vaccine anyway because of your health conditions. Therefore, we're going to have to really work with a lot of those people to find out if they've already been vaccinated or not. So that will be an added level that we need to talk about this weekend on what that might look like.
Thank you, Diego. Adam has one follow-up question for you, Heather.
Yeah.
Go ahead, Adam.
Thank you. Heather, we understand there was a call and discussion today with the county health departments and the state.
Right.
Were you involved in that meeting? And if so, could you was there any message, could you describe, I guess, the tone of that meeting and any message from in general that was sent to the state from the counties?
So sure. So every week we have a call with state officials regarding vaccine rollout. So there's a lot of information on there that just has to do with storage and handling the vaccine and vaccine requirements. You know, we're still getting information about the Johnson & Johnson vaccine since that's still a fairly new product. So a lot of it just has to do with that. However, there was a pretty robust sentiment that our county partners were not happy about finding out this information as late as they did because they were not able to plan either. And that many of our counties still have a lot of people that are 65 and older or within that phase 1B tier 1 group that had not been vaccinated yet. So there was frustration expressed on that call due to that.
Awesome. Thank you, Heather.
You bet.
Okay, I do not see any questions pending in the request box. So I think we will go ahead and conclude. Thank you everyone for joining us today for these updates. I hope we were able to get some information out to our media partners and to our community about these changes in eligibility criteria. Again, as Heather mentioned in her remarks, for updated information, please visit the linncounty.org/COVID-19 page, and we will get information up on that page as quickly as it is finalized. And again, just those prevention messages, please continue to mask up and social distance. And as hard as it is, to be patient with us as we work to vaccinate our community. Thank you.
Thanks, everybody.